Hello, this is Dr. Forrest Lanchbury from Sedona Regenerative Medicine, and today I'm going to discuss a test that we have available now. It's a new test from Vibrant Health. The test is on oxidative stress, and it checks the genetics in the patient, actually how good their genetics are, whether they're predisposed to more oxidative stress than others. It tests actually the genes that are involved with neutralizing what we call free radicals. And so that you understand a little bit more about what that test is and what it can tell us, I'm going to present a slideshow on oxidative stress and what it exactly is. The test will actually tell you what your age is in relative to oxidative stress. So if your oxidative stress biomarkers, which are also tested, are at a certain level, it may indicate that you're older than you should be, or if it may indicate that you're younger than you should be. So this test is actually a good measurement of aging and whether or not anti-aging interventions are beneficial that you may be doing, or at least give us an indication of how beneficial they may be. Um, so let's go ahead and get started then with the presentation. I'll go ahead and share my slides here. I just have to find the thing. The camera's kind of in the way there. Okay, there we go. And let's get started on this. So it's oxidative stress and how does it affect our health? When free radicals, these are formed when we have damage to molecules in our cells, usually from toxins, but it can be from other things, and we'll talk about what that is in a minute. But when these free radicals are formed, we need to neutralize them. These free radicals are basically formed when oxygen loses an electron. And when that happens, the oxygen species, we call it a reactive oxygen species, wants to react with another molecule. And if it's not neutralized by an antioxidant of some sort, then it will continue to damage cellular constituents, which will lead to, of course, disease and illness and inflammation. So let's go to the next slide and talk about some of the causes of oxidative stress. So some of the causes then are, of course, environmental toxins. That includes heavy metals, smoke, pesticides, phthalates, herbicides, air pollution, poisons, alcohol. All those can be factors. Ionizing radiation, medications, chemotherapy, nutritional deficiencies, inflammation, emotional stress, if we don't get enough sleep, anything the body has to detoxify. So when we have this, there's just a little diagram down here that points to this, things that can result in free radicals, and then some of the illnesses that we might expect as a result of that, including cancer is a big one, aging, heart attacks, diabetes, dermatitis, other health complications. So what is actually damaged? Well, we know that DNA is damaged and so is RNA. And also certain constituents in the cell membranes are damaged, the lipids in the membranes of the cell. The mitochondria can be damaged because they also have membranes around them. There's proteins in the body, in the cells that can be damaged. And all of this can lead to illness. So here's some diseases that we see with free radical oxidative stress. And we know that in these patients that have some of these illnesses, that the oxidative stress can be quite high. And oxidative stress can then lead to further problems in these diseases. And of course, these diseases are more likely when you have a lot of oxidative stress. That could include Alzheimer's, Parkinson's, multiple sclerosis, ALS, heart problems like heart attacks, high blood pressure, kidney disease, skin problems, wrinkles, acne, eczema, multi-organ problems, including diabetes, chronic fatigue, fibromyalgia. Lyme disease leads to a lot of oxidative stress. The joints, rheumatoid arthritis, osteoarthritis, psoriatic arthritis. And it goes on. The eyes, the lung, the blood vessels, and the immune system can all be affected and are affected with oxidative stress. So, what are some of the genetics relative to this, free radicals and detoxification? So we know that genes actually determine an individual's ability to reduce oxidative stress from free radical production. So the enzymes which catalyze or speed up reactions, so enzymes actually speed reactions up in the body, and enzymes are critical. If they're not working, then reactions don't occur. These are the critical component actually in free radicals neutralization. So the enzymes that catalyze the reactions to neutralize the free radicals need to be working all properly. And certain diseases and things like metals can actually tie up the enzymes, like mercury, which reduce the body's ability to neutralize free radicals. So this ability to neutralize free radicals and remove toxins from the body is strongly related to the activity of the enzymes in the different organs of the body. The liver then is the primary organ involved in detoxification, but every organ participates in its own detoxification. So the brain, the heart, the kidneys are all involved. So there's actually, when we look at the genetics of this, we know that we get DNA from the mother, and we also got DMA from our father. And so there's actually a DNA code then, of course, for these detoxification enzymes. And so that's what we can test, is we can look at what those genes are using PCR technology, and we can isolate the gene that is involved and identify it. So if both genes code for normal enzyme activity, then the enzyme activity would catalyze reactions at a normal speed. If one genetic code is abnormal, then the enzyme activity is going to be reduced. When both genetic codes are abnormal, then activity will be significantly reduced further, and free radicals are going to stay around longer and cause more damage. So that's basically the basis of the test. So a normal wild gene, so if this is a normal, this is what we expect to see, the gene that we expect to see that is normal, normal activity is going to be recorded as a minus. So we would have the father and the mother, and then we would record whether it's a minus or if it's a plus. Now, if it's a plus, that means that it's an abnormal gene or that it's a mutant. So this gene has been mutated along the way somewhere, and it's recorded as a plus. Now, if both genes are wild, that means that it's a minus minus. That means both genes are what you would expect to see normally, and that would be called a homozygous wild. Now, one wild and one mutant would be a negative and a positive, and what we call that is heterozygous. So that would be one gene is wild and one gene is mutant. Now, if both genes are mutant, that means that neither one of them's wild. They've both been mutated. That's a plus plus, and that would be called homozygous mutant. So homo means the same, and so both genes are the same, and they're both mutated. So that's how that works, and that's what we'll be discussing in the test results. So just a little bit about some of the enzymes, and we'll go over them a little more with the test, but one of them is called SOD, and that's called superoxide dismutase. So this is an enzyme that is involved in neutralizing these free radicals. And how does it do that? Well, we can see in this diagram here where we have oxygen is a free radical, okay, and it comes, in this case, oxygen or some sort of oxidation has occurred, okay, relative to maybe a heavy metal, maybe a toxin like smoke or something like that has damaged this mitochondria, and it releases this oxygen that's a free radical. So this is a free radical. It's lost one of the electrons because of this damage that occurred. So then there is this molecule here. This is an enzyme, a very important enzyme, perhaps one of the most important. They're all important, but it's called SOD, and that's called super oxide dismutase. So it's superoxide dismutase. So you would presume dismutase means that it would be something that could help with preventing mutations. And in fact, it can, because it can reduce the amount of antioxidants or the amount of free radicals in your body that might induce mutation. So superoxide dismutase takes this free radical, and then we said that we need to add an oxygen. We need to add another, not an oxygen, but another electron here because it's lost an electron. So one of the ways it does this is it makes this into hydrogen peroxide. So adding hydrogen and some more electrons to make H2O2. So hydrogen peroxide then is not as damaging as this, but it's still damaging. It can still cause problems. So we want to take that and make it into water. So there's a couple of enzymes that can do that. And one is catalase, and the other one is this GPX. We'll talk about that. It's a glutathione enzyme. And then there's glutathione reductase. So all of this is involved in basically neutralizing this free radical. And all of these enzymes need to be working properly for that to happen. So now I want to talk a little bit about oxidative stress biomarkers. So these biomarkers can actually be measured in the urine, and that indicates the degree of oxidative stress that you have that's occurring in the body based on the level of these biomarkers. So these biomarkers can be used to evaluate damage that is occurring to nucleic acids such as DNA and RNA in the body. Some of this damage, unfortunately, can result in mutagenic activity. That means the genes can be mutated. And then, of course, we know that that can lead to disease, and in some cases, maybe even cancer. So a biomarker called N-carboxyethylysine, this is one of the biomarkers. It's called CEL, just CEL. That's a little easier to say than that big word. But it's an indicator of sugars binding to proteins. So this actually indicates this biomarker indicates how much sugar you have binding to proteins. So this can result in glycation and oxidative stress. So they kind of go hand in hand. When you get the glucose binding to proteins in your body, you're going to have oxidative stress. And this is one of the major causes that leads to aging in the body. And what happens is that these oxidative products from lipids and sugars react with amino acid called lysine, and lysine is in a lot of your proteins. So this CEL then reacts with this end product, this AGE, this advanced glycosylation end product that has bound glucose, and it reacts to these receptors in the body. This results in a lot of oxidative stress, and then that causes cell dysfunction. So if we can measure the level of CEL in the urine, that's going to indicate the degree of oxidative stress occurring in the body, and this will actually correlate quite well with cellular age. So that will tell you how old your cells are. And so if you're 45 and your cellular age is 50, I mean, that's really kind of what your real age is probably 50. Now we can reverse some of that, and there's ways we can do that, and we'll talk about that later. So some biomarkers of oxidative stress. So 8-hydroxyguanine, that's 8-OHG, that's abbreviated 8-OHG. This results from free radicals attacking these nucleic acids in the DNA in the cells. So the one that is attacked most commonly is guanine, because guanine is a nuclear acid like adenosine and thymidine, and there's one other, cytosine. So this is in DNA, guanine. And so guanine is more easily attacked, okay, for whatever reason, but it gets oxidized. And so when it's damaged, this can cause the telomeres of the DNA to actually shorten. And also in other areas, including the mitochondria, has DNA, and it can get damaged, the mitochondrial DNA. So this telomere shortening, that's one of the ways that we determine how old a person is by looking at their telomeres. And we can see, how old they are based on the length of their telomeres, because every time you get damage to these telomeres, they can shorten. And so it also seems to induce mutations. So this 8-OHG can induce mutations, and it's associated with the degeneration of the nervous system and also the cardiovascular system and aging. Then the other one is 8-hydroxyguanosine, 8-HDG. That results from free radicals attacking nucleic acid guanosine. So in RNA, it's guanosine replaces guanidine or guanine. Okay, so guanosine is found in RNA and it can be damaged like the guanine, but we get a different result here. We get what we call 8-HDG, 8-HDG or 8-hydroxyguanosine. Now, urinary levels of this then indicate damage to RNA, and it's also mutagenic and can induce mutations in the RNA. So the next biomarker that we can measure is called nitroguanosine, 8-nitroguanosine. So this results from oxidation of guanosine by a nitro-free radical. So this is NO2 nitrous oxide. And this free radical, again, it's from loss of an electron. And the production of this is especially frequent where there's inflammation. And just as a side note, some people have a genetic problem where they don't neutralize that very well from a different type of mutation. But anyway, this is also mutagenic, so it can cause mutations. And the level of this biomarker has been correlated with mortality and traumatic brain injury. So if somebody has a brain injury, you can measure this because there's a lot of oxidation that's occurring of this RNA in the brain, and that can predict the mortality in that patient. So it has good predictive ability that way. And also in a lot of cancers, in the literature, it shows that this can correlate with how bad the cancer is, the severity of the cancer, especially gastric type cancers. And even with H. pylori, which is a bacterial infection that causes ulcers, this 8-nitroguanosine will go up. And viral pneumonias, they did a lot of study with this, looking at a lot of studies looking at COVID with COVID and how much this molecule was elevated, because it was thought that nitrous oxide was actually part of this, part of the problem with COVID, getting a lot of excess production. So how do we reduce oxidative stress? Well, there's a lot of ways, and I won't go over every single way here, but it's on the slides here and they'll be available. You can stop the slides or stop the video, I suppose, and write it down. But most of the therapies, I will just say, most all of the therapies that we do that are regenerative type therapies are going to reduce oxidative stress, because you have to have low oxidative stress in order to get regeneration. So you're not going to regenerate, your body's not going to heal in the face of high oxidative stress. So another possible use for this test for myself or people that do regenerative medicine would be to do this test to look at the patient's actual oxidative stress levels and their genetics, which could have possibly some prediction as to how well that patient would respond to stem cells. Now, I don't know that would, I would suspect it would definitely be true as far as how much oxidative stress there was. I don't know about the genetics, but the oxidative stress level would certainly determine whether the patient is going to respond as well to stem cells. And that may be one of the factors that we see when we see patients that don't do as well with stem cell therapies. Okay, so then we'll go ahead and start going over this oxidative stress profile. And with this particular patient who was around 40-year-old female, and I did get her permission to go over the test with you, but I did remove her name. Okay, so what is the oxidative stress profile? And so we talked about some of this in the slides there, but we have these enzymes, and there's several of them here that we're looking at and that we're measuring. And we're going to look basically at the genetics determining how well these enzymes are basically synthesized by the body and how active they are. You know, how are they working normally or not? So there's these different ones. This is glutathione synthetase which actually takes this free radical and makes it into a soluble extracellular toxin so the toxin can be excreted. And this is glutathione S transferase. It's also involved in that. We talked about the SOD enzymes, superoxide dismutase. There's actually 3 of those, and they're all involved mostly with making hydrogen peroxide. And then there's a couple of enzymes that are required to get that hydrogen peroxide into water. And so that would be catalase. And then this GPX, which is glutathione peroxidase. So the peroxidase will take the hydrogen peroxide and help make it into water. And so then sometimes we get these free radicals with oxygen and a hydrogen here, an OH free radical. And this free radical actually can cause lipid radicals. And this is in the membrane. Like we talked about the membrane of the cell, that it could be damaged and you could get free radicals. So this is one of the places that can occur. And this also requires some enzymes, because glutathione will be reduced. In this case, glutathione is reducing this free radical. Glutathione is actually the most powerful antioxidant in your body, and your body manufactures it. But you need these enzymes and everything for glutathione to work right. And some people don't produce as much glutathione as others too. But anyway, this glutathione is really utilized a lot when you have inflammation and you have a lot of free radicals being formed and a lot of oxidation occurring in your body. You use a lot of glutathione. So that's why we sometimes administer glutathione. At least regenerative or functional type doctors do that to help people neutralize free radicals, and as a powerful antioxidant in the body. You can take it orally or you can take it IV. You can do it IM. There's some patches. There's some things that actually help your body produce glutathione, but this is a critical antioxidant. So, but it won't work well if you don't recycle it. Okay, so basically this enzyme here is involved with oxidizing glutathione here in order so that you can get some stable lipid products, so that you can neutralize these free radicals. And then this one here, this GR, is glutathione reductase, so it actually recycles glutathione. Okay, so if this enzyme isn't working well, you're not going to recycle your glutathione very well. So if you have genetics that are affecting this, you're going to have issues with recycling it and running low body levels of glutathione. And so that's just basically a rundown on how those enzymes work. Let's go right down to the results then on this patient. So let's look at, so all these enzymes are tested. So we have SOD2, SOD3, and a couple of different ones with SOD3. There's a couple of different genes there that are involved with that. But SOD2, we can see that this patient has plus plus. Remember that I said if it's plus, that means that that's a mutation, okay? And if you have both pluses, that means it's homozygous. So this patient actually has both genes that are affected. So this would significantly reduce the enzyme activity. So this SIDO-D2, superoxide dismutase, is going to be moving slower. It's not going to be catalyzing these reactions that we need to catalyze this reaction up here in order to get this free radical made into hydrogen peroxide. So then there's another one here, SOD3, that's involved. Again, we have a homozygous result, a mutation in both genes. So both the mother and the father donated mutant genes, and we have a plus homozygous mutant. Unfortunately, this enzyme is also affected in the same way. We have a homozygous mutation plus in this SOD activity. And the test does go into actually pretty thoroughly describing the actual function of these enzymes and what they actually do, in a more complete manner than what I just described. So So that's available to learn more about it. So then we go to CAT. So CAT is this enzyme here. So this is taking H2O2 and converting it into water. And we actually have a homozygous mutation in this enzyme. So both mutations in both codes, in both genetic codes, which is going to significantly reduce this being able to take this to this. So in this patient, actually all of these enzymes are going to be working slower, and this enzyme is also going to be working slower. So then the next one we're looking at is GSS. So GSS, and so that's going to take us up here where we take the free radical into soluble extracellular toxin. So that, again, we have a homozygous result. And this is going to actually result in lower glutathione levels overall and elevate the risk in the patient for problems. And again, we have this one that's affected PK AA2, and that particular enzyme is not on here, but it's talked about later. But it does, it is very important, this particular enzyme, and it's involved in a protein kinase, but essentially it's going to impair your antioxidant activity when it's not working right, and you're going to get an elevated risk. Then the next enzyme, this one again isn't listed up there, but this is a major gene that encodes a number of these cytochrome P450 enzymes that are involved in detoxification in the body and with neutralizing free radicals. In fact, a lot of medications are detoxified through this particular molecule, or the CYP1A1, which is the cytochrome oxidase complex. So this superfamily of enzymes in this patient is also affected with homozygous mutations. So we're again going to have elevated risk. By the way, this particular CYP1A1, the cytochrome P450 superfamily, is very involved in detoxification of drugs, and drugs are one of the big things that can act as an oxidation problem. So they can cause a lot of free radicals. So medications, and especially if they're not metabolized right, you can have toxicity that results from the medications fairly easily. So this can be an important thing with these patients, that they may have a lot of trouble with certain medications that are going to go through this pathway, which unfortunately are a lot of medications, but that creates more free radical stress. And perhaps that's one of the reasons that we don't really see mortality reduction with blood pressure medications that are taken long term. If you look at some of the studies, don't show that we really reduce mortality long term, because they may counteract. There may be counteraction because they're causing more oxidation and more free radical damage. Antibiotics, in fact, cause more free radical damage because they act as a toxin in the body, and they have to be detoxified. So there's several. I could talk about almost any drug that you might take that would do that. That's another reason that we like to steer clear of medications if we can. At least in my case, I don't like to prescribe a lot of medications because they do cause damage to the body almost always, and a lot of it's through this pathway, through creating free radicals and oxidation in the cell and damage. And of course, you could see how the genetics would significantly affect people, based on their genetics. In fact, in this patient that's having a lot of trouble, or could potentially have a lot of trouble with detoxification, may have issues with medications, would probably definitely have issues. And so that can be another thing that can be very beneficial with this test too, to look at, how much risk does this patient have for, really having toxicity from, in this case, medications. And if we go to this GPX1, this is the other one that we've seen up here. That one is on here. And so that one is involved in glutathione peroxidase. So it's involved in actually getting, it's involved in helping glutathione work, but also recycling glutathione. And so this one, we just have one gene, one plus, one negative, or one minus. So that means it's heterozygous. One gene is a mutant, one gene is a normal wild type. So there would be partially elevated risk in this patient for detox issues, free radical formation, but not as much as if it was homozygous. So again, then this one is GPX1 and GPX2. Those are both involved in that glutathione regeneration, detoxification pathway. And these both have selenium. These are involved in selenium. And it actually, if you have a defect in these enzymes, you're going to have more of a tendency to have selenium deficiency. And that's because you need selenium to detoxify, and you may not be able to regenerate or use selenium as well. And that's going to lead to problems with detoxification. So these patients definitely usually benefit from selenium, and they will often have selenium deficiency. Now, in this patient, she had 1 plus, 1 minus, but it could still lead to issues with selenium. So that's another interesting thing that you can get from this test, is whether or not the patient may need more selenium than another patient and be predisposed to deficiency. So this is another one. It's called heme oxygenase 1. So this is involved actually in the blood in the heme. And this one, if you have problems in it, you could have issues with mitochondrial heme detoxification. So we have to detoxify the heme, which is a protein that results from red blood cells from recycling them. And you have to get rid of it because heme can be toxic if it builds up. So if you have a problem with this, it could lead to more oxidative problems, more free radical damage. This was heterozygous, plus she was heterozygous plus minus, and she had decreased antioxidant activity in this one. This is GSTMS. It's another glutathione transferase enzyme, so again involved in glutathione. And we have a heterozygous result there. So then they did test quite a few others here, and CYBA, this is involved with NAD, with recycling NAD and utilizing NAD. And if you have problems here, this will also lead to a lot of free radical production, more than usual, lack of energy production. And all of this affects energy production. And really, that's the bottom line when you get right down to it, is if you don't detoxify, if you don't get rid of toxins adequately, then you're not going to be able to detoxify, because the toxins will build up, but you're also going to reduce your energy production, because the toxins will interfere with energy production and the production of energy molecules like NAD. So NAD, that's one of the reasons that NAD can be very helpful in patients, with patients to take NAD in some way, or when patients have certain diseases, or with things like addiction that have significantly large amounts of problems with a lot of oxidation, free radical formation. And an alcohol is a really really good at inducing free radicals, so and causes a lot of oxidative damage. So NAD can be very helpful in alcoholics or in others that have addictive problems, because we can help restore the energy production through NAD and to help the patient detoxify. It significantly helps detoxification. So this is actually looking at some of that pathway with NAD. In this case, it's NADPH, but it's part of the same type of pathway. and energy production is going to be down when you're low in these enzymes, and you're not going to detoxify well. So if we look at XDH, this is another one, xanthine dehydrogenase. This is involved in purine compound detoxification. And these purines, if they build up, you get gout and things like that. So this could lead to elevated ROS production if you have a defect in this particular enzyme. This one here is decreased antioxidant activity leads to elevated oxidative stress. It's GSTP1. It's another glutathione transferase enzyme. So all of these, we had heterozygous findings, so partially elevated risk with these. So now I want to talk about the oxidative stress profile. So, I mean, not the we just talked about that. There's one other enzyme here, I guess I failed to mention. This is the selenium production leads to, it impairs selenium production. It's selenop, SELENOP. And there, that was heterozygous. But if you have problems here, then you're not going to have, um, you're going to have issues with selenium. Plasma selenium production and deficiencies going to result. So again, that can point you towards the need for more selenium supplementation. And this patient definitely has a lot of heterozygous findings in all those selenium molecules. As we've seen here, there was this one, and then now this one is heterozygous. So certainly likely would benefit from either increase in selenium intake of food, probably both, and maybe some amount of selenium deficiency. By the way, Brazil nuts are a good way to get selenium. And there's a lot of different foods at high, like beef, turkey, chicken, fish, shellfish, and eggs all have significant amounts of selenium. And Brazil nuts, you eat about 4 average size a day, usually gives you the minimal daily requirement of selenium. So, and maybe a little more. So let's look at oxidative stress biomarkers. And so these biomarkers are the following. We'll discuss them. We did discuss them in the slides, but this one here can lead to DNA. They all can lead to damage to RNA or DNA. But her findings show, actually, I thought she should be higher on these biomarkers, but I think she's doing a really good job with her antioxidant intake and some of the interventions we've made with her, including weight loss, which she had started losing weight. And that helps a lot to reduce your oxidative stress, and these biomarkers will go down. So that can tell you a lot about weight, and how it affects, because you'll see elevation of all of these biomarkers in obesity. And so that will lead to a lot more oxidative stress, of course, and disease with these. So this one, hydroxyguanine, was elevated. They were all elevated, but they weren't in the red zone. So they're higher than we want, but not in the red zone. And so then this one here is the one I talked about that is involved in glycation, where the glucose binds to proteins in the body. And this particular one, this cell interacts with the receptors for the AG product, the advanced glycosylation end products, and that leads to a lot of oxidative stress. It goes hand in hand. So when this one's elevated, you have definite indication of increased oxidative stress, but also aging is correlated with this. So then this actually, well, you get a creatinine level. This is for accuracy to make sure that you're excreting adequate amounts of creatinine by the kidneys. That helps, that actually makes these findings more accurate. We know that they're accurate if your kidneys are working properly. So this is a oxidative damage score, and what this shows is where is the patient relative to their age. And so this patient's age is 41 years old, and her oxidative stress profile looks similar to a 50.6-year-old. So given the fact that she has these, we're looking at mainly these biomarkers here. The genetics determine like how well you're going to get rid of toxins, right? So if the toxins build up, then we get elevated biomarkers, and then that's going to correlate with your age. So, or correlate with how old you are. So if you're up in here in the red, then that's going to be really pretty rapidly accelerated aging. This is moderate accelerated aging, and this down here would be normal, healthy aging. So all of the things that can lead to increased free radical production, including your genetics, can lead to more rapid aging. So that's any kind of inflammatory process. That includes vaccines, that includes medications. All of these things lead to more rapid aging, and that's verified. And one of the unfortunate things is with the COVID vaccine, led to significant inflammation in patients, as did COVID infection, which one would presume would lead to more rapid aging, and it does seem to. I don't have any test results on patients, obviously, before they took the vaccine, but we will have results on vaccinated patients. And I expect that unless they have a lot of intervention for antioxidant type therapies, that we're going to see uh, more rapid aging in those patients. Um, so these are just like this is some recommendations for this patient. These are all antioxidant interventions and nutrients, and it talks about how these support detoxification. There's certainly a lot of other things that you can do, and I discussed some of those in the slides earlier. Hyperbaric oxygen therapy, I think, is a wonderful way to reduce oxidative stress. And we see how well that treats a lot of different illnesses and diseases that all have oxidative stress underlying the disease. Other things including ozone therapies, stem cell therapies, um, any kind of regenerative therapy, lasers, cold lasers, infrared therapy is an antioxidant, LED light, red light, antioxidant. One thing is the sun, UV radiation. Obviously, the sun has benefits, but too much UV radiation can lead to oxidative stress. So we have to be careful about how much UV we get from the sun. And any kind of radiation is going to cause problems. And one thing I did not mention, but we know causes a lot of oxidative stress, and I know some people are well aware of this, is electromagnetic fields. So electromagnetic fields are again going to cause a lot of stress, including cell phones, which result in oxidative stress. And this test is actually, something that could be used to monitor in some way. It's probably difficult because there's a lot of confounding variables, but you could use this to help monitor EMF exposures. And when you do interventions to reduce EMF, you should see improvement in these oxidative stress biomarkers. So the genetics actually, in this test tell you how likely you are to have more oxidative stress than another person, because even given the same exposures, right, you could have the same exposures to cigarette smoke, environmental pollutants, alcohol, heavy metals, EMF. You could both have the same exposure, but one patient having enzyme problems, having genetic issues, is going to have more problems than the other person. So if we take somebody who, for instance, drinks alcohol or smokes, one person doesn't seem to get the diseases the other person got, and perhaps this would be one of the reasons because of the genetics of that particular patient. So through doing this test, it could tell you like, wow, your genetics are showing that your enzyme speeds are really slowed down because of your genetics, and you're not going to detoxify as well, and you have elevated biomarkers for damage that's occurring in your body. You shouldn't be around any type of cigarette smoke, or you shouldn't be drinking any alcohol, maybe none at all, or very, very little, because anything like that is going to cause more oxidative damage. And so you can see how this would have utility that way, with helping patients to convince them that wow, you really need to make some lifestyle changes here because your genetics are looking this way. I mean, not that they're going to do it, but I mean, it would give them possibly some more motivation to do it. So this is a really good test, I think, to look at to help patients reduce oxidative stress, but also to look at patients' ages relative to this. What is their age and what is their risk for aging more rapidly, and what kind of interventions can we make in the patient to help them age less rapidly, which is my objective, and that's what we all want to do, really, no matter what kind of medicine. I mean, if we're practicing any kind of functional medicine, regenerative medicine, really what the bottom line, we want to reduce aging. We don't just want to put a Band-Aid on stuff. We don't just want to, get rid of pain, which is important to get rid of pain, but we want to regenerate. So we want to help the patient do that. Now, so this is a way to help the patient do it. And this is a way doctors can help patients heal. Okay, we don't heal. No doctor heals. No person heals. Nobody heals themselves. The body, as you can see with this, the body has to be the one. The body gets to be the one to heal. And so we just help that process along, right? Okay, so that's all I have for that. So you're welcome to put any questions in the chat or on YouTube, and I'll certainly try and get back to those. And if you want to have this test done, you can, if you're already a patient, we can arrange for it to get done fairly quickly. If you're not a patient, we can do a consult and look at your whole picture of health, and put all that together and do this test and see how we can help you. All right, that's all. Thank you.